So what I'm going to do today is I'm going to go over the basic eligibility rules for long-term care Medicaid. This is not community Medicaid. Their Medicaid covers a big swath of social programs, but primarily what we're concerned about today are people who need to be either in a nursing home or are looking for home care or an assisted living under the waiver program. And we'll get into that. But basically, those are the parameters of the webinar today. So I'm going to start by describing kind of what the eligibility rules are, and we'll get into some of the nitty-gritty of that. And then I'm going to talk about some of the rules getting Medicaid at home or an assisted living, and we will go from there. And again, if you have any questions, please feel free to put them in the Q&A box, and I'll be happy to answer them. If you can't find it and you find the chat box instead, that's fine too. Whatever way you can get your questions to me, I'll be happy to respond. All right, so I am sharing my screen. I'm hoping that you can see that. Medicaid was created by Social Security amendments that were passed in 1965, and Medicaid, right around the same time we had the Medicare program. And so Medicaid and Medicare, unfortunately, have names that are very close to each other. It would have been nice if they had named them something different. But Medicaid is different than Medicare, and that Medicare is basically an insurance program. So as an employee or as a worker, we pay into Medicare with our Social Security, and that buys us the Medicare insurance that we need when we are aged or when we are disabled, because if you're a disabled worker, you can also get Medicare. Medicaid is a federal program. In other words, it's under the law in the Social Security Administration. However, states actually administer the program. So it's and the states chip in money and the federal government chips in money for Medicare. So it's a federal state program. The federal government sets some broad rules, and then the state government has a little bit of leeway as to how they implement those rules. If you go from state to state, you will find differences with Medicaid, but you also will find some general concepts that are the same, because those are the federal laws. In order to be eligible for Medicaid, you have to be financially eligible. It's not a program that you automatically get. So the idea that you work for a long time and get Medicare is different than Medicaid, in that with Medicaid you have some financial eligibility rules, which we will get into. The federal government, there's the Centers for Medicare and Medicaid Services. They administer the Medicaid program for the federal government. In Ohio, we have the Ohio Department of Medicaid, which, 5, 6, 7 years ago was created and is now a cabinet level department. It used to be just kind of part of the Family Services, but now it's it's its own agency. However, Ohio Department of Medicaid still contracts with the Department of Job and Family Services to implement Medicaid. So if you go and apply for Medicaid, you're going to do that with the Department of Job and Family Services. The Department of Job and Family Services kind of handles the money part of it, whether you're financially eligible. The area agencies on aging handle some other criteria. For instance, are you sick enough? Do you qualify for Passport, which is the program that gives Medicaid at home? And so when you are looking to go into a an assisted living under Medicaid, or you want home care under Medicaid, you're going to also be dealing with the Area Agency on Aging. And we'll talk a little bit more about that. So you can see that there are a number of people with their fingers in the pot in trying to obtain eligibility. So when I think about Medicaid and becoming eligible for Medicaid, and I look at the 10,000-foot view, there really there are three things that we, in order to become eligible. We have to be sick enough, so we have to be medically eligible. We need to be eligible for income purposes. In other words, our income can't be too high, and we'll talk about that. And then the asset eligibility. So assets or resources, we need to make sure that we are within the guidelines, the 5-year look back. And so that is a major consideration as to whether a person will be eligible or not. Have they gifted or have they given money away in the last 60 months, the last 5 years? I prefer really to not call it a look back period. I prefer to call it a reporting period, because that's really what it is. You have to report whether you've given any money away over the last 5 years. And we're going to talk about the consequences of that a little bit later. So, those three major prongs of eligibility. The first is medical eligibility. The government's not going to pay for us to go to a nursing home and hang out and eat bonbons. They want to make sure you're sick. So you need to be in a nursing home, you need to have at least an intermediate level of care. And an intermediate level of care, a lot of us have heard of the skilled level of care, which is a little bit more intense care. If you have a skilled level of care, you certainly can also be in a nursing home under Medicaid. You need to be at least an intermediate level of care. So we're going to talk on the next slide about what an intermediate level of care is. But I also want to note that there are people who have developmental disabilities who end up in nursing homes, and before they will be eligible for Medicaid, there's a screen that is done to try to screen out people who have no real need to be in the facility. They're just there because of a mental illness or a developmental disability. So generally people with developmental disabilities are not allowed to be on Medicaid in a nursing home unless they have some kind of illness that requires them to be there. So the idea is we don't want society just dumping people with developmental disabilities into nursing homes. So that is another kind of requirement that most people don't have a trouble with, but sometimes people do. So what is an intermediate level of care? Basically, there are activities of daily living, and activities of daily living are things that we do every day that you probably don't think about. Dressing, bathing and grooming, feeding ourselves, ambulating, moving from the bed to the toilet, those kinds of things. So if a person needs hands-on assistance with 2 activities of daily living, they are sick enough to be on Medicaid. So Medicaid will pay for a person's stay if they need hands-on assistance with 2 activities of daily living. Also, there is a, and I don't know why they separate it, but they do. There is the issue of medication administration. And generally, if you have to have hands-on assistance with medication administration, that will kind of count as an activity of daily living. And the issue here isn't that you just need someone to remind you to take the pills or something. It's that you physically need someone to help you take the pills. You're paralyzed, you have Parkinson's, and so you can't hold the pills, things like that. And you have to show that you need that. You actually need that other person to help you with the medications. If you have that and one activity of daily living that requires hands-on assistance, then you also are eligible. And then the last potential, and this is very common, is that you may have a person that doesn't need any assistance with activities of daily living. They can bathe themselves, they can dress themselves, they can eat, they can walk. But if they have Alzheimer's and they're going to walk not only in the house, but they're going to walk down the street and not know where they are, that is a qualification for an intermediate level of care. So if someone has dementia, if someone has Alzheimer's disease, if someone has a cognitive impairment which prevents them from caring for themselves and they need to be watched 24 hours a day, then that person will also be eligible for Medicaid under the health category. Okay. If there are any questions about the health category, let me know. I have one question about gifts, which I will get to in a little bit as part of the program. All right. So the second prong is income. And income kind of used to be easy because if you didn't have enough income to pay medical bills, your nursing home stay or your care at home, etc., that was generally considered enough, that you just didn't have enough money, enough income coming in to pay for the care. In 2016, there were a bunch of changes made in Medicaid that included a big one, and that was that we went from a 209B state, which was the type of state that we were before, and now we are an income cap state, meaning that there is a cap on the amount of income that you can have and still be eligible for Medicaid. So we're going to talk about that in a sec, but before we do that, what is income? Generally, most of my clients, it's Social Security, pension, PRS, state teachers retirement, those kinds of monthly payments that are received would constitute the income. There is a rule that I mentioned here that potential income has to be explored by the agency. And when I say the agency, I mean the Department of Job and Family Services when they're looking at your Medicaid application. If you just decided, I don't want to take my money from PERS, they're going to make you take it, because if you don't, then you can be denied from Medicaid. Now, why someone wouldn't want to take it, I don't know. But if there is income available to you, you have to take it, and it will be counted. So what are the income limits? So right now, if you have $2,350 or more, you are not eligible for Medicaid, period. So if you have $2,349 or less, you're okay. A married person, this rule applies the same way, whether you're married or not. The person who goes into the nursing home has to have less than $2,350 per month. However, all is not lost. If your income is over $2,350 a month, you can set up a special trust called a qualified income trust or a Miller trust that can shelter some of the money from Medicaid. And a qualified income trust is it's a simple trust, but basically what happens is you set the trust up, you sign the trust, you say it's for the benefit of the person going into the nursing home, and you go to the bank and you open up an account in the name of the trust. And so I have an example here that Fred has $3,000 a month in income from Social Security and pension. And in applying for Medicaid, he creates a qualified income trust. And each month, he puts $1,000 into the qualified income trust. And mechanically, what happens, the Social Security comes into his account, the PRS, the pension, whatever it is, comes into his bank account. And out of that money every month, he takes $1,000 and he puts it into the qualified income trust account. So it's actually physically moving the money out of his account, putting it in the QIT. If he puts that $1,000 in the account in, let's say in July, because we're in July, then in July, he doesn't, for Medicaid purposes, he doesn't have $3,000 a month in income anymore. He now has $2,000 because we had $3,000, we moved $1,000 over, 3,000 minus 1,000 is 2,000. So now Fred is eligible under the income under the income prong, okay? So it's just, I mean, if you're cynical and you want to look at, bureaucratic nightmares, it is a bureaucratic nightmare, and it's really silly because there are all these people that are opening up two accounts when the only thing that they're going to have them in them is $2,500 or so. However, in order to be eligible for Medicaid, you just have to do it now. So that's what we do. Some nursing homes will actually handle these transactions for you. So they will set up a separate account in the nursing home, and they'll, transfer $1,000 over into the other account. That is sometimes easier for my clients than actually going to the bank. You have to be careful that the nursing home is doing it right, because I've had some problems with that too. They may, if they have the wrong amount that they're taking out every month, there can be a problem. So now the other thing to understand is, just because we're moving money into that trust doesn't mean that Medicaid doesn't know it's there. So Medicaid still requires us to pay our bills out of that account. And there's kind of a hierarchy in who can be paid out of that account, first, second, third, fourth, fifth. And if you don't pay the money out during the month that the money is put in, it apparently stays there and will not go out at all. And once you pass away, then the state of Ohio goes back into that account and sweeps and is able to sweep the money out. That's part of the account, is that's a payback trust. So it pays Medicaid back for anything that you've used. So when people are using the qualified income trusts, they need to be careful to both bring the money in and send the money out. Some accounts will be zero balance, which the banks don't always like. But, if you need to keep a small balance in there, I think that's okay. But the idea is you want to have as little money at the end of the month in that account as possible. So hopefully you followed that. If you did not follow that, please feel free to give me a question in the Q&A, and I'll answer it. So that is the income prong. If you have under 2350, you're okay. If you have over 2350, you have to have the qualified income trust. So the third prong is resources or assets. Assets are basically, the way I used to describe them is, they're anything you can put your hot little hands on and turn it into cash. It's not quite true, but that has typically been the idea. If you can reduce it to cash, it's an asset, unless it's specifically exempted under the law. And there are things that are specifically exempted, which we will go through in a minute. So countable resources are any resources that are not exempted. So Medicaid counts those. And why do they count them? Well, because if you have more than $2,000 for a single person, then you're not eligible. So you have to be down to $2,000 or less in order to be eligible for Medicaid and in countable resources. The married couples have a different system, which I will explain. However, when we're all done with that, if there's a husband and wife and the husband is in the nursing home, that husband eventually will not be allowed to have more than $2,000 in his name. The wife will be able to keep more than that. And part of it depends on how much they start off with. And we'll get into that in a minute. So, what are exempt resources? Exempt resources include household goods and personal effects of reasonable value. I like to tell my clients that you can't just, Medicaid's not going to come and look around your house and see, if you have gold bars under your couch or anything like that. However, if you're getting ready to apply for Medicaid and you go out and buy a $40,000 ring, that's probably not going to be considered a household or personal effect of reasonable value. So you have to be careful about what you're doing, but generally the stuff in your house, they're not going to count. I did get a specific question about the QIT, which I will go back to real quick. The question is, what types of expenses get paid out of the qualified income trust? There's a list, and essentially it is that the medical expenses can be paid. So in other words, if you're in a nursing home or an assisted living and you have a patient liability, that patient liability can come out of there. So if I'm in a nursing home and I'm supposed to pay the nursing home $2,000 or $3,000 of my money every month, I'm going to have to take part of it out of the qualified income trust, even. So it's really going to go in and come back out. You can pay the spouse if Medicaid finds it's important to pay the spouse. You can pay each person who's in a nursing home or assisted living is allowed to get $50 personal needs. That can come out of there. And so it's just those kinds of things. You can't, if you do it wrong, they can call it an improper gift. So you have to kind of be careful as to what comes out. And hopefully I answered your question. Exempt resources, continued. Automobiles, so one automobile is exempt. Life insurance policy with a face value of $15 or less is exempt. And this doesn't include term policies. Term policies are counted because they have no current value. You can't cash them in for anything typically. However, a whole life policy or some other kind of permanent insurance can be an asset. So if you have a policy that has a $2,000 face value and it's worth $2,000, that's going to be countable. If it's a $1,500 face value and the policy is worth $2,000 because the death benefit is going up, it's not counted. So they look first to the face value. If it's $1,500 or less, they're not going to count the cash value of the policy. Okay. There is an issue with what we'll call dividend accumulations in these policies, and sometimes you see them and sometimes you don't. I have seen state hearing decisions saying that they are exempt, and I've seen some saying they're not exempt. So I always worry a little bit with those because I think they should not be counted, but there is some language in the statute that creates a little bit of ambiguity. So insurance policies, most of them are countable, but there are a few small ones that are not. Annuities that are in payout status and meet some other qualifications that Medicaid has will be exempt. So a lot of people will go out and buy annuities. That does not mean they're exempt. They're only exempt if they are kind of locked in that money out, then Medicaid's going to count it. If I go to the annuity company and say, here's $100,000, I want you to pay me $1,000 a month for the rest of my life, and they say okay, and they put that, that's in the annuity contract that they're just paying me $1,000 a month, that's income now to me. It's not an asset. That $100,000 is gone, and I've traded that $100,000 for the right to get $1,000 a month for the rest of my life. That is not going to be a countable asset if it's set up properly. Okay, so, and that is sometimes a way that people will, when they're trying to spend down money for Medicaid, where they'll actually take some money and create an income stream out of it by buying an annuity. The house that you live in, so I'm going to call that the home, because if you have a house in Florida, it's different. If you have a home in Ohio and you live in the house and you're an individual person, that house is going to be exempt as long as you either live in it, or if you go to the nursing home, you say, I intend to go back to my house, that house is going to be exempt. There's a cap of a little under $600,000. So if you have a $1 million house and there's no mortgage on it, there's going to be $405,000 that Medicaid is going to want to count as an asset. So they look at the equity value. So if you have $1 million house and there's a $500,000 loan against it, the house is worth $500,000. Even though you could, sell it for $1 million, you'd only get $500,000 out of it. So that equity cap went into effect about 15 years ago, and I really have not seen it used very much, but it is there. So if you're married or you have a dependent, minor child, a blind or disabled child, a child over 65 who's dependent living in the house, that house is also exempt. So you may have to argue with the department about whether the rule fits to your circumstance, but if it does, that house is exempt. Medicaid cannot make you sell it. Let's see, the value is the equity. I already said that. So generally the house is fairly well protected. One of the problems we run into with single people is that if you go on Medicaid and you're single, you don't have a lot of other money to pay the bills, to pay the mortgage, to pay the taxes, the insurance, etc. Because when you're a single person, typically your money is going to pay for the nursing home. So even if it's exempt, you may at some point have to figure out a way to get rid of it if you are going to be in the nursing home for a very long time. Burial plots and irrevocable burial contracts are sometimes looked at similarly, but the burial plot is actually the land that you're going to be buried in, or a family member is going to be buried in. So Medicaid will not count yours. Like if you have 6 grave sites, say they're not going to count 5 of them and exempt yours. They'll exempt all of them. However, irrevocable burial contracts has to be yours. And if you buy one for someone else other than your spouse, it's potentially an improper gift. Okay, but if you buy 5 or 6 burial plots, they generally do not see that as an improper gift. I see less of this now, but I used to have a lot of clients that had Holocaust reparations being paid. If you pay those into a bank account, that bank account is exempt as long as it is not commingled with other money. It's also not income, the Holocaust reparation. If you have a retirement account, like if a husband and wife, if you have a couple and the husband goes into the nursing home and the wife is actually working and has a retirement account, that if she quit, she could get the money, but if she doesn't quit, she can't, then Medicaid's not going to make her quit her job to get that money. They will not count that. Okay. There's a new issue on the horizon, which is actually a fairly big deal. And that is that retirement accounts, meaning 401ks, IRAs, 403B accounts, all these accounts that are pre-tax accounts, including Roths, are also considered retirement accounts. These accounts may be totally exempt if they are in payout status. Well, what does payout status mean? Well, payout status means that you are taking the required minimum distribution out every year or some greater amount every year. So if they are paying money out every year, they will be considered to be in payout status. The rules are new in this area, and so when not, I'm not exactly positive how they're going to handle this. So, and they're still working on training materials and things like that. So, but it looks like they're going to say that if you are taking money out on a regular basis, they are not going to count the retirement account. Now, that's a really big deal because for two reasons. One is it means that there's a lot more money for people to hang on to and still be eligible to be in a nursing home. The other issue is that it may be that, and we're going to get to this in a second, but it may affect people who are married couples negatively or positively. So I'll explain to you why as we move on to those issues. But it really is a big change. And there were some counties in the 90s that were looking at whether it was in payout status, and that got wiped out in some regulations in the late 90s, early 2000s. But now it appears to be back. So we'll see how that shakes out. But that's a new and exciting change. Real or personal property essential to the means of self-support. There are some kind of arcane rules about real property, and when it's exempt, it can't have very much equity in it. But if you had a business, they typically would not make you sell that. If you're a carpenter, or your wife is a carpenter or whatever, someone in the family's a carpenter, and they use those tools in order to create income, they're not going to make you sell that property. Okay. Let me know if you have any questions about any of that. I'm going to talk now about what happens with a husband and wife. A husband and wife, husbands and wives are treated differently than a single person with Medicaid. It used to be that before 1988 and before, it used to be that a spouse in the community could really be in trouble when if her husband went to a nursing home. And I'm not trying to be insensitive to gender roles, but typically in the 80s, when you had someone who was retiring, or when you had someone go to a nursing home, it was often the man, and the man was the one who usually worked, and the wife was often someone who may have worked but was also at home with the kids for a lot of their lives. And so their Social Security checks were very small, and the husbands were large. And to make a long story short, basically, if they had joint accounts, the husband had to spend all the money in the joint accounts. The husband's total Social Security check would go to the nursing home, and the wife, who had a $300 Social Security check, would have no money and only $300 in income a month, and she would be impoverished. So finally, Congress said, look, we got to do something about this. So we're going to put these spousal impoverishment rules into effect. We're going to basically treat a husband and wife as one economic unit. And we're going to basically split the baby in half. The husband can keep half, the wife can keep half. If the husband goes in the nursing home, he has to spend his half down. Now, that doesn't necessarily mean that, half of the assets are going to be in the husband's name and half in wife's name, but they just look at them, it doesn't matter whose name it's in, okay? So the spouse in the community is allowed to keep a portion of the couple's assets. In order to determine what she keeps, we have to determine when the first continuous period of institutionalization is. And we call that the snapshot date because it's kind of like Medicaid. It takes a snapshot of what the assets were on that date. All right, well, what is that date? If a person goes to a hospital and or a nursing home, and it happens a lot that way, someone falls, breaks a hip, goes to the hospital, stays there for 5 days, goes to the nursing home for rehab. If he or she is in the nursing home and hospital for a 30-day period, that starts the first continuous period of institutionalization. Okay, so there's a snapshot made of it's the first day of the month that the first continuous period of institutionalization occurred in. Okay, so they're going to basically, if I'm married and if I fall down the stairs after getting off this seminar and I crack my head and I need to go to the hospital and need rehab at a nursing home, if I'm in there for 30 days, that's my day. I get one in my lifetime. And so they would look at our assets as of today, and they would basically split them in half. If I had to stay in the nursing home, my wife would get to keep half of our assets, and I would have to spend my half down or do something with them. Now, the reason why the issue with the IRAs and things becomes important is when we're talking about what assets we're splitting in half. If my IRAs aren't counted, if my retirement funds are not counted, then my pie may be very small because most of my assets are in IRAs. So that may end up affecting things fairly significantly. But so basically, Medicaid says, what are the assets on the snapshot date? Let's cut them in half. The wife and the spouse in the community gets to keep half, up to $128,000 and change. Okay. The husband or the person who's in the nursing home gets to keep $2,000, right? Because so basically it's about $130,000 that a couple gets to keep. I have down there that there's a minimum. So if a couple had $30,000, the minimums that the spouse is going to be allowed to keep is $25,728. So if a couple had $30,000, they would only have to spend down, about $4,300. So let me know if that makes sense. But basically, that 30-day period of institutionalization is really important because, and I'll show you why. And this year is a great example because we've had huge fluctuations in the market, right? We were at the highest level, in March, and then coronavirus hit and we were way down, and then things have kind of come back. So just playing with that idea, we have a couple named John and Judy, I think. So John goes into the hospital on January 1st, 2018, then goes to a nursing home afterwards for rehab on the 7th of the month. He and his wife have about $300,000 in countable assets as of January 1st. Well, his first continuous period of institutionalization starts January 1st, 2018. Since he stayed there till February 1st, he's been there a full 30 days. So now $300,000 is the snapshot amount. So on April 1st, 2020, now we're talking, we're talking 2 years later, right? 2 years later, he falls down and he has to go to a nursing home. And this time he's got some medical issues, he may have to stay. So because of COVID now, on April 1st, their assets were down to $125,000, maybe a little spending. So now the couple has $125,000. How much is the wife going to be able to keep? Well, Medicaid divides the assets as of January 1st, 2018. So there's $300,000. They cut that in half and they come up with $150,000, right? Well, again, we have a cap of $128,000 and change. So that's the most she's going to be allowed to keep, even if half is $150,000. So she's allowed to keep the maximum which is $128,000. Because they now have $125,000, she gets to keep everything, okay? She gets to keep the whole 125, and they should be eligible for Medicaid in April when they apply. Now, one of the nice rules about Medicaid is that once there's Medicaid eligibility, a spouse in the community, if she goes out and wins the lottery, she gets to keep it all. So if this 125,000 now turns into 250 because the market has gone back up, she gets to keep the whole 250. Okay, it's kind of a once in a lifetime thing. I haven't seen the market go down and up this fast ever, but I thought it was an interesting illustration of how the snapshot date can be different than what the reality is, when you're applying for Medicaid. So I ask in this slide, what happens if we have kind of the opposite, right? Let's say that John goes in March 2020 and the assets are 125,000, and he stays in for 30 days, he comes out, and then on July 1st he has to go in again. But by July 1st, the assets now have grown back to $300,000. Well, because the first continuous period of institutionalization on April 1st, we have to look at half of what that value is. So half of 125 is 62,500. That's all that Judy's going to be allowed to keep under the state's scheme here. If the assets grow to 300,000 by July 1st, now they've got $300,000, and she's only allowed to keep 62,500 because that was half as of the date of the first continuous period of institutionalization. So I just use that example to show you that those two things can happen at different times. A lot of times they happen at the same time. So someone will fall down, they need to go to the nursing home, they're going to stay. We just look at that. If it's the first time they've been in a nursing home, we use that value. Okay, but there can be bad outcomes because of this. So I say there at the bottom, luckily a good elder law attorney may be able to help preserve some of the 237,500 using other asset protection planning. So we might buy an annuity, or we might use that money to create some amount for the wife who's in the community, because we don't want it all to have to go for his medical expenses if it can help support the spouse. Okay. Any questions about that? If you have any questions, I know it's confusing. If you're a visual learner, it might be hard to understand that, but essentially the spouse in the community is supposed to be able to keep half of the assets when the spouse got sick. Okay. Now, so feel free to ask those questions. I'll come back to them. Someone asked, can you give all of your assets to one or more people in just 1 year? So what Medicaid does, hopefully this will be answered in my explanation. The answer to the question is sure, you can give it away, but the question is what are the consequences? Okay. Medicaid doesn't prevent you from giving gifts away. Medicaid only determines whether it's going to pay for care or not. So if you want to give all your money away, that's fine, but you do have to tell them, because if you don't, then that can get you in hot water. And so you do have to tell them, and if you've done it within the last 5 years, there are going to be some consequences if someone needs care in that 5 years. So from the date of the application for Medicaid, Medicaid will ask what transfers have been made during the prior 60 months. Okay. We often encourage nursing homes and other providers not to apply for Medicaid too early, because we don't know I mean, if you apply for Medicaid and someone has transferred assets 4 years and 11 months ago, that will come into play. And so we really want to know what's happened in the last 5 years, because, there are families that will give large wedding presents, will help people buy houses, things like that, all without even considering whether they're going to be applying for Medicaid or not. But we want to make sure that we don't apply too early, or we don't apply when they're clearly not eligible, because this is one of those things that only happens once. If I apply for long-term care Medicaid today, my 5-year look back is 5 years back from today, right? But if I apply again in 20 years, technically I have a 25-year look back period. I have to describe to Medicaid what has happened in the last 5 years from my first application. So we need to be careful of that. So one of the questions is, do they ever go back farther than 60 months? And that's the only time when I think they have the right to go back further than 60 months. It is 60 months from the date of application. So right now, they cannot go back more than 60 months prior to the application date. All right, so what they do is they say, what have you transferred in the last 5 years? The sum of all gifts. So if you give a bunch of gifts at one time, or you could give a gift 4.5 years ago, or you can give a gift 4.5 days ago, all of those are going to get added up together. And then what Medicaid does, and the one myth that I want to disabuse people of is that just because you've transferred assets, it doesn't mean that you're automatically ineligible and you're never going to get Medicaid, because that kind of is the idea that people get out there. No, the issue is that for each approximately $7,000 that you gift in the last 5 years, Medicaid is going to say, once you become eligible, we're not going to pay for that number of months. So if I give $70,000 to my son today and I apply for a nursing home in 3 years, Medicaid's going to look back and they're going to say, okay, well, there were $70,000 gifted. You are not eligible for 10 months. They divide the average cost of a nursing home, which is about $7,000, into the amount I gifted, which is $70,000. We come up with 10 months of penalty. So when I say penalty, they call it a restricted coverage period. I call it a penalty period. There's just a period of time where Medicaid is going to refuse to pay. And, in the old days, that started from the date that you transferred the money. Now it starts from the date that you're eligible for Medicaid. Okay, and that can go longer than 5 years. So you need to be careful not to apply too early if you've made large gifts. So the question, can you give all your assets to one or more people in just 1 year? You can, but there's going to be this consequence. One of the things that people do often is they get tax law and Medicaid law mixed up. Tax law says you can give away $15,000 per year without it affecting your estate and gift tax liability. Okay. For most of us now that don't have $22 million lying around, or $11 million for a single person, it's not going to affect us anyway. But the $15,000 a year thing, you can give $15,000 to 20 people if you have $300,000, but Medicaid's still going to count that as an improper gift. You don't get any pass because the tax law says that that's not a problem for gift tax purposes. So Medicaid doesn't care about the tax law. They just care about their law. Okay, so if money is given away, that's, we often have to deal with that, and we can deal with that in some ways. I've had nursing homes come to me and say, hey, I've got this person they've got a little bit of money left, but they gave away this money, what can we do? And we might take that money and buy an annuity to help pay for the nursing home during the time that the penalty period is going on. Just the idea is we got to figure out a way to pay the nursing home during the time that Medicaid won't pay. So as a review, we talked about health eligibility, income eligibility, and asset or resource eligibility. And we talked about what happens if there are improper transfers or gifts, that it will delay the eligibility based on the amount of the transfers. So if you transfer a little, it's going to be a short period. If you transfer a lot, it's going to be a long period. The final part of our talk today is about the different places you can get long-term care Medicaid. And we're all familiar that you can get it in nursing homes, but Ohio has also created the Passport program, which has now got to be getting close to 20, 25 years old. And the assisted living waiver, which is a little newer. So you'll see waiver, as you notice that in numbers 2 and 3, you see the word waiver. And waiver just basically means that the state of Ohio, they come up with a plan and they go to the federal government and they say, listen, there are all these rules that you'll pay for Medicaid in a nursing home, but we want you to waive some of these rules for us so that we can, for instance, give care at home, or we can give care in an assisted living. And so that's why they call it a waiver. So the assisted living waiver, the state of Ohio has gotten permission from the federal government to waive some of the rules that would normally prevent a state from being able to pay for nursing home care in an assisted living. So we have the Passport waiver, the assisted living waiver. There are other waivers out there beyond the scope of this talk, but so those are the 3 areas that I like to talk about. Most elderly people who are needing care can be cared for in one of these 3 places. So the assisted living waiver, we talked about intermediate level of care being needed in a nursing home. It's the same thing for an assisted living. Assisted living can provide intermediate care. They also can provide some skilled care, but for less days than a nursing home can. Nursing home can do it 365 days a year. So in order to be eligible for the assisted living waiver, you need to be in an assisted living that accepts the waiver, that actually has a bed that's been certified as a Medicaid waiver bed. You have to have a certain amount of income. You have to have $783 in income this year. If you have less than that, generally you can apply for supplemental security income or SSI, and you can reach that level. Generally, there is a $50 personal needs allowance, which means that once you go into the assisted living on Medicaid, you're going to get $50. You're going to get to keep $50 from your Social Security or pension or other income to pay for your personal needs. Okay, toothpaste, toothbrush. $50 doesn't really pay for most women to get their hair done. At least not in the way that they may be used to. So it's really not very much money. One of the rules that was waived is that if I need a nursing home and I go to the nursing home and I say I'm on Medicaid or I'm applying for Medicaid, the nursing home cannot say, I'm sorry, we want you to pay privately for 2 years before we'll accept Medicaid. The assisted livings they can require that a certain amount of time be paid for privately before Medicaid kicks in. So that is a difference. There are many assisted livings that have, just have a few Medicaid beds because they want to make sure they don't have to kick anyone out if they run out of money, which is nice. but it also limits access. And in the assisted living community's defense, they don't, the reimbursement rates aren't very much for these beds. I think they probably lose money on them. That's my guess. But so they are not they're not incredibly there aren't a ton of them. Sometimes it's hard to find a assisted living bed in an assisted living under Medicaid. And that, to me, as trying to help people get in, it seems like it's more difficult to get Medicaid in the assisted living. A lot of things have to line up right. But when you can be in an assisted living on Medicaid, it's a nice thing. I've had several clients or many clients that have, been in an assisted living for a while, and that was the only thing that helped them get from getting kicked out, which is a good thing. There's a question: are waiver communities listed on the ohio.gov site? If you go to the Ohio Department of Aging, they have those. They have a full list of assisted livings and the ones that have waivers. We will be sending out an email to you tomorrow with a couple things in it, and I can try to get that link for you. But the question is, are they listed on the ohio.gov site? And they may be on the ohio.gov site, but I've only accessed them on the I think it's the Department of Aging. So, okay. So that kind of covers the waiver, the general idea of the waiver programs. Assisted livings are, the assisted living waiver, assisted livings and nursing homes really are able to provide a lot of the same kind of care to people. But some assisted livings, you kind of have to ask a lot of questions to make sure that your loved one is a good fit for any particular home, because there's a wide variety in how much care that will be provided. So it's good to be kind of an educated consumer to know which assisted living is going to be the best for you. All right, so the next waiver program is Passport. We had one question about assets to get Passport care. All of these programs go by the same essential financial eligibility rules. Okay, so if you're going into an assisted living or you're on Passport and you get more than $2,350 or more in income, you're going to have to do the qualified income trust, like we talked about. If you have a spouse in the community, you're going to have to do the split of assets that we talked about. So all of these rules apply in nursing homes, assisted livings, and and at home under the Passport program. For Passport's is a great program. It allows you to stay at home and get basically nursing home type care at home. Is not going to provide 24-hour coverage. There is a budget that has to be determined. And so everybody who applies for Passport, the Area Agency on Aging comes out the house. They do an assessment, they do a budget, and they try to figure out how much care is going to be needed in order to keep someone safe at home. Once they determine that, they also can take into account family caregivers. So if there are two 20-year-old people in the house and they are providing care to mom, Passport will take that into consideration in putting the budget together. So if a person needs 60 hours of care a week and the family is providing 15, Passport says, well, we can provide the 45. Passport also covers kind of, it's interesting that really the goal is to make sure that the person can be at home. So if they need a ramp, if they need, I mean, I've even had, you know, Passport pay for extension and for, you know, just ramps, different things to make sure that a person can stay in their home. Passport will generally be able to pay for that because the whole goal is to keep people at home. Essentially, the budget amount is, it's about $35,000, $36,000 a year. It's 60% of what the state thinks the average cost of a nursing home is. And so as long as they can provide safe care at home for that amount, they'll approve the case. You still need to have an intermediate level of care. It's the same kind of requirements. If you have someone who has dementia, they would qualify also. And again, you know, in addition to applying to the Department of Job and Family Services, if you're applying for Passport or the assisted living waiver, you also have to work with the Ohio Department of Aging. So the Department of Aging is the one who does these kind of medical assessments. So that is my, those are the ends of, that is the end of my slides. If anyone has any questions, I'm glad to stick around for a little while. What we normally do is we will send out tomorrow, we'll send out an evaluation, we'll send you a booklet that is really nice for planning for yourself. And I will try to get you also the link to the assisted living list on the Department of Aging website. So we can send those things out to you tomorrow. If you have any questions, please feel free to put them in the chat or the Q&A, and I will do my best to answer them. If not, I really appreciate all of you attending, and we are providing a lot of different kinds of seminars as we socially distance here, and so you're welcome to look at our website and see what other things we have coming up, and we'll be happy to see you in any of those. The one last thing I would ask is, if we've tried a couple different times, like today we did 11 and we did 4. We've done these on the weekends. If when you're doing the evaluation that we send out to you, you have a second to say, geez, this was a good time, this is a bad time, I'd rather be at 7 than 4 or whatever, we would appreciate that kind of feedback. We want to make sure that people can come. Thank you very much. Thank you all.